Hi, I'm Dr. Rahman, and today I'd like to talk about the unholy trinity when we're talking about vaginitis. That's yeast vaginitis, BV, or bacterial vaginitis, and trichimonas vaginitis. Now, vaginitis means that there's inflammation, irritation, and discharge in your vagina. Now, the distinction between the three, with the yeast vulvovaginitis, there can be a white cottage cheese-like discharge along with itching, swelling, redness of the skin on the outside of the vagina. With bacterial vaginosis, not so much of a irritation, but it's usually a white yellow creamy discharge with a foul odor. A lot of women describe this as a fishy odor. Now the third is trichimonas vulvovaginitis, and with trichimonas, unlike the other two, trichimonas is considered a sexually transmitted infection, and sometimes women are not aware that they have been exposed to the trichimonas. The way that trichimonas, BV, and yeast vaginitis is diagnosed is either in the office using a microscope or through laboratory testing. Treatment varies depending on the infection. There's over-the-counter treatment and there are prescription drugs. The problem comes because women often self-diagnose and in the process misdiagnose what type of infection or vulvovaginitis they may have. They may be calling a yeast infection BV, or a BV infection a yeast infection. Or there's the possibility that they may have more than one vaginal infection going on at the same time. It's possible to have yeast and BV at the same time. It's possible to have trichomonas and bacterial vaginosis at the same time. So what is a woman to do? There are treatments and you can Google them, and some of them are worthwhile and some are not. Some practices are good, some are not. I always start by saying do the simple things first. Always use basic hygiene, water, mild soap. You don't have to do anything else. The vagina is quote unquote self-cleaning. Basic hygiene, avoid perfume and other products in that area. Be careful about the sanitary napkins that you may be using. The other thing that I say is watch what you eat. Eat well. Avoid the sugar, the dairy, and the highly processed foods. It only works to your advantage. And then the third thing, besides basic hygiene, eating well, the third is watch what you put in your vagina. That's a no-brainer. So this is Dr. Rahman saying that it is not uncommon for a woman at some point in her life to be exposed to one of the three that compose the unholy trinity: yeast, BV, and trichomonas. So do what you can to stay healthy, because your health is priceless. And this is Dr. Rahman talking to you, trying to make it clear. Feel free to send me a question. Love to talk to you.